Okay, I have given you that God, Lord, please give me strength to pass out smoothly in anatomy. The Japomala at this contest is your vertebral column. It is all fixed in your cord. It is arranged from cervical vertebra, then thoracic vertebra, the lumbar vertebra, the sacral vertebra. When I told you, when you are reading, you please look into your atlas or your, see, these are the, how many cervical vertebrae are there? 7. How many thoracic vertebrae are there? 12. And how many lumbar vertebrae? How many sacral vertebrae? Okay, okay. Now, that is gone, simple. Now, there are some typical vertebrae, there are some atypical vertebrae. You have to distinguish. Now, you see the cervical vertebra. It is different from the thoracic vertebra. Thoracic vertebra is different from the lumbar vertebra. With the idea, the evolution of erect posture. I told you previously, but I just couldn't get my file ready there. I could not find it. So much volumes of PowerPoint presentations are there in my collection. Now, but I'll show you because it has a very interesting first slide, second slide, very interesting. In next class, I will definitely expect that I'll be able to show you. It's just 15 minutes slideshow will be there. Now, that's I've prepared it in this thing. Now, with the evolution of erect posture, you think that your quadruped, imagine if you are believing in Darwin's law and the spine, you know, এদিকে ধরো ব্যাগ বাচ্চাগুলোকে রাখ ওখানে মাটি কাদা মাখা এই এমনি করে ধরে আছে হিস্টোলজি করছে ব্যাগ নিয়ে আরে ইউ বি কমফোর্টেবল দিস আর কজিং স্ট্রেস बैग जाएगा तो तोड़ जाएगा फट जाएगा ऑनलाइन में ले आओ now see if you see it in this form this is in the lateral view the cage stage ache to see you had a different the curvatures why I'm specifically saying this because there are some disease condition where the curvature is lost. Curvature is lost. The bones are not lost. The curvature. And the thoracic cage, now having ribs, having a sternum. These ribs, cage, it is a cage like this. Naturally, to protect the lungs, the organs, you go to the head, the skull, but the cervical vertebra is small, supported by the vertebra, also the muscles of the neck and the posterior muscles of the neck. It is up to these muscles. These muscles. Now, what happens if you see all of a sudden someone calls you or pushes you, you get cut. Or some people are having, hey, আমি বলে দিই তারপরে দেখি definitely. Some people are having a habit, especially those people are doing your gym and all this. So that doesn't mean that I am not supporting to do, not supporting gym work. Workout must be done. Next thing you have to hard tuck, every habit, একটু এরকম করে হাঁটতে লাগলো. These postural attitude or this effect, it affects the body. For that time, a moment, you don't realize it, but you will realize it. But it should be done in a proper way. Your gym or this thing, you're dancing and all. But suddenly you do, some people you see walk over, tuck at awaj holo. And especially you go to this salon, unisex salon. See, you're taking, I'm taking a massage and all this. And suddenly I see they don't have partitions in them. What I'm saying is in the your Facebook. You see, reels. Suddenly one looks into this. The guy puts in. Sometimes you say, "It ghade bata hoche, then everybody goes tuck." Male, mostly male. So tuck. It makes a noise, or I don't know if he say, everybody got a awaaz kore dilo. Aram pachi. Then he comes out with the pain in the neck. He comes out with the pain in the neck because there is some stretching, some things that should not be indulged. When you go to the salon for your haircut or something, you must be careful. You don't. খুব মজা লাগে the guy who even he's inexperienced. Nowadays I can become a barber. আমার যখন এরকম হাত চলবে না তখন আমি একটু কয়েকটা টুলস নিয়ে বসে যাব, একটু কেটে গেল বসে না, এ তো বিরাট কোহলি কা কাট হ্যাঁ, ও বিরাট কোহলি. So these things has to be stopped. Or whenever you are testing for a neck injury or your any pain that patient complains, then you have to make small movements to examine. You say it like this, you put your hand like this and press. This is one exercise. Now this, you press this counter press. Because of the muscles or the vertebral, there's pain due to some reasons. Now the cervical vertebra is different from because it has having a foramen. That the vertebral vessel is going through this, because neck is this, it's not abdomen. Now in this condition, the vertebrae are one after the other. Then you see, I told you you see it in this lateral aspect, lateral. Okay. Now you see the spines, you can see the spines here. The spines. And these are the processes. Okay. Now that articulates in the thoracic level, it has facets. Which two vertebrae or three vertebrae don't have facet? One facet is there. You know what is floating ribs? 11, 12. Why you say floating? But all ribs are not connected to the sternum directly.
A false tip connect with
এদিকে বলো. ঠিক আছে. Now this curvature I'm telling you. Now this is the sacrum. See the sacrum. Now this is the articulated pelvis. This will be in your examination table. Okay? This is an articulated pelvis. Now the sacrum articulates with Sacrum articulates with the pelvic bones. Okay. How many pelvic bones are there? Two pelvic bones. Fine. Now, see the posture. See, the thing is that you have to hold it like this. You have to hold it in an anatomical position like this, not like this. Then the curvature is lost. But it should be like this. You don't hold it like this. Don't hold it like this. You hold it like this. Because the spine is not anterior. Imagine if it was, then what would be the anatomy of that person? But it doesn't happen actually. Okay. Now, it is like this. For beauty contest, hip, beauty contest এর সাইজ কি কি দেখে নেবে দেখে নেবে আর তুই মাথা নিচু করছিস কেন রে তোকে বলছি এই ছেলে বদমাশ আছে কিন্তু নাও যারা যারা এরকম করে থাকে না চুপচাপ একটু ইয়ে অ্যাকচুয়ালি আমি কিন্তু ভালোবেসে বদমাশ বলি even my two daughters I sometimes tell hey badmash so now this is the articulated pelvis formed by the two now sacrum is also called this sacred bone why it is sacred it is covered until unless you are nude something is covered the sacrum is covered it's a sacred bone কি হলো কথা পছন্দ হলো না বইয়ে আছে কিন্তু now it is in the book it is a sacred bone it's also known sacrum the word came from your because it is covered bone that is covered okay একটা because any person male or female will always try to cover এতটা খোলা থাকবে কিন্তু এই জায়গাটা এটা ঢাকা দেবে now see আরে সেই কালকের লেকচারটা খুঁজে পেলাম না পরের দিন খুঁজবো now see these are the atlas axis see the axis this is the atlas now see the transverse foramen this is the now you see the you see
এখানে atlas নেই
atlas are missing
atlas missing
okay that I mean explain করে this is the atlas and you see these two lateral masses anyway in this mala one rudraksh is missing it is there bring এটা হারিয়ে গেছে না ওইভাবেই ছিল হারাইনি now you see that axis is having a now this is the odontoid process the superior articular surface that articulate to the inferior articular surface of the atlas This is the first, the second. Now, the thing is that a lady or a man, he commits suicide, or it was a homicide. Homicide, suicide means self. You die with poison or something like that. Or hanging from the fan, ceiling fan. Now, see what happens. The vertebra, this is articulating the skull, first vertebra. And second vertebra has a process. This is the dens. This is articulating with a small surface here, oval surface is in like this. Now what happens? You tie, don't tie please. You neck around any rope or any your chunni and hang. Okay. If it is for reels or to frighten your parents, never do it. Because suddenly, what happens when you want to plan to do some suicide by hanging? Never do it. Life is beautiful. So enjoy. One thing, why I'm telling you, this is a small bone. See, you are doing this. In nowadays, some, go to some temples and all, and some sadhus and sadhikas, they are doing, you see, anything. Okay, in some dance or something like that. But that is, see how much that revolving and this thing, the open hair is giving a big show. But why I'm stressing is that it's a small bone that is articulating, the dens is articulating the atlas. It's a small, this thing. It's suddenly you jerk, that breaks first. Now, it differentiates from the homicide. In homicide, when they do post-mortem, the dome means the technician, you don't call dome nowadays. That they cut the neck, and say, dens fracture হয়ে আছে. But if I blow and put some poison or something, then I hang you from a tree, that bone doesn't break. Second cervical vertebra, the dens does not break. And why immediately you get death is that it compresses on the medulla oblongata. This whole from the brain, the structure that first encounters in the thing is medulla oblongata. All important centers are there. When we tell you about your brain and spinal cord and this, that's why I'm telling you. आज sacrum पढ़ाना था, तो ये बोल रहा है vertebra, वो तो पीछे है. I want to just brief you and go to the thing. It is not only syllabus oriented because it's all interconnected. You have to orient your reading, your thoughts and everything in this pattern. But I'm not saying that my pattern is universal. It's not universal. That I confess. So universal patterns you have to fuse. Vodka, whiskey, cocktail. You take things. Now I'm telling about your your now why I'm telling you the end of the spinal cord, they go there. Corda equina fibers. These are the it is like this. It is like this. So now this is the sacral promontory. This has two ala. See, the ala are the sacroiliac joint. The ear you hold sacrum like this. The sacral promontory anteriorly, the ala of the sacrum laterally. Okay. Dorsal hiatus, this and this opening. Okay. Posteriorly. Okay. See the anterior part and the posterior part. See the anterior is smooth. It will be like this. And the lateral portion, you hold it like this. You can hold. Nervous or you have not read. Possibilities and probability is 50-50. Theory of probability means you take a coin and you toss. 50 times it will be heads, 50 times it will be tails. It can be you do toss for 1,000 times. So, and the ear-shaped articular surface which forms the sacroiliac joint is laterally and anteriorly. But if you do it like this, it can. I have seen people getting nervous or not read or not seen that. That's why I'm whatever you are doing it online, you do it. I have no this thing, and you don't have to. You have to pass. My thing is that you have to pass. But main your test is in the practicals. Now practicals, I tell you, you get many ways of the marking is there. 5 marks, OSPI, 10 marks, radiology, like this. So that practically carries off. Exceptionally, जो नहीं बोलता है मुंह में, तो उसका बात छोड़ो. Now you hold it like this. Now what are the muscles here and what are the ligaments of the articulated pelvis? The articulated pelvis is here. You have to relate. And there is a muscle, E-shaped muscle. What muscle? Piriformis. E-shaped muscle. And posteriorly, you think of this, you think of the ligament, sacroiliac joint. Sacroiliac joint over here. There is a cartilage and this thing. But see, this is ossified. It out ossified actually. Ossified. And you have the sacralization of lumbar vertebra. Radiology, you do a backache, radiology, this thing, your hip joint, your sacral joint, back, lumbosacral spine. In the backache, you do a radiology. You have epilateral views, then you might be finding that the your lumbar vertebra, the transverse process is bit enlarged. And in the neck, what vertebra? 7th cervical process. There's a cervical rib. What is cervical rib? Okay, when you will be teaching the head neck, would go. Now, this is the thing that you have to know, and now some important relations on the ala of the oils. Obturator, no, then iliolumbar artery from lateral to medial. Obturator now, iliolumbar artery, then sympathetic chain. Okay, this is important. The structure thoracic, and it forms the major part of your pelvis, and this is important because there are these landmarks. If you do a internal examination or vaginal examination, when a lady is coming with labor pain, then you have to access that how much, if there is pain, and or dribbling of amniotic fluids. Then you have to do a assessment. The head has come down. But sometimes when you feel it, the cervix is only 2 fingers dilated. And the scalp, it is pressing. It becomes like a now the scalp, it comes out like this. Then soft. It is not this bones, skull bones. It's not the skull bones. That means it is being obstructed. With the outlet, the small, plus she is failing in power. So this assessment, then you go for an LUCS. You give a call book to your senior when you get an opportunity. To see the pain, your patient is in labor pain. Okay, then you have to access. Everyone doesn't go for a cesarean section, wants a cesarean section. Till now. না বাবু আপনি নর্মাল ডেলিভারি চেষ্টা করুন. So you have to assess, you have to explain to this thing, and you have to access. You are in a health center. Though everything is communicable in Purulia, some health center, or in Birbhum, Nanur, तो देखेगा वो भेज दो. Refer to Sian. Now you become a referral doctor, but with knowledge. Now, this is the outlet of the pelvis. This is the inlet. Now, only by vaginal examination you can diagnose maximum. But today people are not patient. They want. Like the mother of 2 children has become a grandmother. Now her daughter has come for a delivery. She is in labor pain. ডাক্তারবাবু ডাক্তারবাবু দেখুন দেখুন মেয়েটা আমার মরে যাবে, মেয়েটা মরে যাবে। আরে বাবা তুমি দেখো না, হয়ে যাবে। স্যালাইন দিলে দিলে you give Syntocinon and some other drugs are there to accelerate the process, but don't give it, it's a timing. You have to know when it's to be timed to give that drip. आपका one finger loose है, आप 4 ampule Syntocinon देंगे नहीं. Now and your things are that sacrum को sternum मत बोलना और sternum को sacrum मत बोलना. Now this portion is definitely different. Sacrum is called a sacred bone. ধরুন এ 90 স্কোর করছে, তখন আমি এসে বসলাম. My student has come as an examiner. कैसे दे रहा है ये बच्चे, कैसे दे रहा है? He's come from Bihar, examiner. He came for 3 exams. Yusuf. तो सर आप पूछिए ना, आपका लड़का है, पूछिए. I'll want him to get a gold medal or honors, or I want you to get a gold medal or honors. You have answered all the things very well. Then I'll give you 5 marks. I'll take that opportunity. When my examiner is asking, Banerjee, आप बोलो, आप पूछिए, और वो 2 काजू मुंह में डाल दिया और एक ग्रीन टी पी रहा है. This is the examination, this thing. And this is the first time that I took 2 cups of tea in the dissection hall. I never do it. I never do it. Even in my OT, I don't drink a cup of your coffee or tea. That day, I broke my 50 years of this thing more. Now, please, যেদিন ঘুমোতে ইচ্ছা হবে বাড়িতে ঘুমোবি. Okay, now please see, everything is open. Everything is open, I told you. Whatever you want, you please take it from Avinash and those people. তোমরা সময় নষ্ট করো না. And histology খাতা, please get it corrected by next week.